Abcodia focuses on the early detection of cancer, developing innovative ways to detect cancer before it progresses to late stage, and therefore obviously we can hopefully get better outcomes and better survival rates. Well, we look at changes generally of blood signals and how those might change over time. And we have access to a huge cohort of longitudinally provided serum samples from 200,000 women over the UK, collected in a high-quality facility that's frozen in liquid nitrogen. And we look at changes over time in those samples to detect interesting signals and then couple them with maths to interpret those changes. Well, let me give you an example of the ovarian cancer test that we have, which is our first-line test. It's called the ROCA test, and it really looks at the change of a marker called CA125. And for a woman who's having this test, she would have a simple blood test. That blood level, serial blood samples given over time would be interpreted by this, and we would refer her into ultrasound very rapidly. And this will be done annually in postmenopausal women where the ovarian cancer incidence is high. And hopefully by that rapid referral into ultrasound, confirmation with ultrasound, we can then effectively get her into clinical care for investigative techniques if required. We were initially collaborating with University College London, and it was really Professor Ian Jacobs, who was the founder of the ovarian cancer test, and indeed the trial that has yielded these blood samples. And so it was really there trying to work with him to think about how we could capitalise on this massive collection of serum samples from these women who've kind of kindly donated these samples for the benefit of the trial, but also subsequent studies. So that was really what spawned it. Obviously, early detection of cancer is absolutely fundamental. And we collaborated and formed an alliance with UCL to be able to use these samples for our development research. Personally, I think we've all been affected by cancer. My mother died at the age of 43 from colorectal cancer, and I think, you get to a point in your life where you think, there's some personal motivations. And so once I'd met Ian, yes, I could see the business opportunity as well as the ethical opportunity to make a difference to women, particularly in the ovarian cancer space, but obviously many people who suffer from cancer in whatever way. We have a team in Cambridge. We've also expanded into the US as well. And so we have colleagues in Boston. But a diverse group of individuals who can help us launch the test, to understand, to think about the research. I have an R&D director who has always worked in the Cambridge space. We've delivered a clinical service, collaborating with a clinical lab in London. There's lots of kind of partnerships that we have. We have an alliance with Cancer Research UK as well to use our samples with innovative technologies provided by companies over in the States to look at proteomics and proteins and various changes that are happening longitudinally. So I think our network is pretty global. We're working with people on the Babraham campus as well in lipidomics, and people in the States as well. Well, I see the next big thing as probably preventative healthcare. We're becoming much more aware of our health, and we have access to so much biological technology and wireless technology that I think being able to monitor our health through genetics or through gadgets that we wear, wearable technologies, and regular surveillance. I think our mindset is really right for that now. So I think there's going to be a lot more of this. Cambridge is just a fabulous centre for collaboration. Our investor is based here. Cambridge Innovation Capital is one of our 3 investors, and we love being part of this community.